We are here today with Dr. Deborah Cox, Chief Academic Officer at Madisonville Community College, and she has 3 of her faculty with us, and she is going to tell us the exciting story that they are sharing.
We are thrilled to be able to share with you what's happening with our nursing faculty. These 3 faculty are completing their doctorate in nursing practice. A part of their degree program is what we call a capstone experience. And each one of these faculty will describe to you their capstone experience and the impact that it is having on the communities in which we serve.
Okay, would you like to introduce the ladies to
I
us?
would. We'll start with Marcia Woodall, who also happens to be our nursing program coordinator and nurse administrator.
My capstone project is colorectal cancer screening, and part of the reason why I chose it is because it is still overall the 3rd highest diagnosed and killer of all cancers. Part of what I'm doing with my capstone is we had to choose a target audience that had a need, and I chose the City of Madisonville employees as a target audience. Mayor David Jackson is in the process of increasing and expanding Fit for Duty, which is a wellness program for the city of employees. The police department, fire department are already in that program, and he's looking at promoting wellness within all the employees at the city of Madisonville. One reason that it is so important to screen for colorectal cancer is it has often been named the silent killer, which means that by the time a person has symptoms of colon or rectal cancer, which we refer to as colorectal cancer, it's already in the latter stages, and the treatment is not as effective, and it's late stage, so the death rate becomes higher at that point. So we're hoping by doing this we can target audiences, provide education, because I think part of the reason people just don't know. Our capstones have all been tied to evidence-based practice. So an extensive literature review has been done on this, and it's showing that people do not choose to get screened because of lack of knowledge.
Next, I'd like to share with you the project of Sarah Jane Jones, who is also in the same nursing program and has a very unique project that she would like to share about nursing mentoring.
I'm planning to develop and implement a nurse mentor program at Jenny Stewart Medical Center in the emergency department. A nurse mentor program is the intentional assignment of a new nurse or a newly hired ED nurse to a seasoned nurse. The purpose of the mentor program is to offer an experience to the new nurse that will mold them and welcome them into the culture of the organization, because at times nurses feel very stressed, overwhelmed, and that is reflected in the literature. So a nurse mentor program aims to reduce those stressful situations and builds a collegial relationship within the nursing profession at the organizational level to retain those qualified professionals. A recent study that's done nationally each year in 2014, it was documented that at least 14% of registered nurses within the first year leave their initial jobs, and that 37% are ready to change jobs within 1 year. And so during this time of a critical nursing shortage, organizations just simply cannot afford to lose the qualified professionals that they have.
Next, we have Loretta Elder, and Loretta will share with us her capstone project, which is very unique. Madisonville Community College and Baptist Health have entered into a joint project to create a simulated hospital. And Loretta's project will involve that, and I will let her share with us how that's going to work.
I worked with Baptist Health Madisonville administration, nursing administration in particular, to select a capstone project. And so that it'll make a nice fit for the hospital as well as the nursing staff. My project will involve utilizing high-fidelity simulation to assist nurses in recognizing early signs of clinical deterioration in patients. So the high-fidelity simulation, the literature supports that simulation provides a safe area for the nurses to practice and learn from. The simulation hospital will especially help with communication between interdisciplinary teams, for example, nursing and respiratory or nursing and physical therapy, so that we can put together some simulation interventions where we all work together, because that is key for safe patient care.
As you can see, I'm very proud of these faculty. What they've chosen to do with their the work in their doctoral program it's far-reaching. I believe it will change how we approach healthcare in our area.
We have been talking today with some faculty from Madisonville Community College regarding their doctorate of nursing that they are currently pursuing and the capstone projects that they have chosen, and we look forward to seeing and hearing more about that. This is Tammy Holloway with Surf Kentucky.